always working with patients who are raising their hand saying, I want to do this, I want to tell my story. And just having thoughtful interview techniques, I think, is really important. Letting the person know that, you're recording it because you want to be able to get everything right and not be taking notes constantly. Letting them know that if they're more comfortable, they can invite somebody else to join the interview. They can stop the interview at any time. They don't have to answer every question. And just building some rapport with them, like getting to know them as a human, not just an example of a disease state. Hi, everyone. I'm Alexson Calahan, founder and president of Small Adventures Communications, and you're listening to the Public Health Insight Podcast.
You're listening to the Public Health Insight Podcast, your go-to space for all things public health and global health, from the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about the diverse career opportunities that exist in these fields. Remember to subscribe to the podcast and leave us a rating on Apple Podcasts and Spotify so other people like you can benefit from our content. So Alexson, when I hear public relations, and this is where I'm inviting you to, correct me or guide me along the right way so I understand things correctly here. But what I think of is you have institutions, you have governments, you have organizations, agencies, people even, and the goal of it is to maintain a positive reputation amongst the clients, customers, or the broader public in general. Is this too much of a narrow-minded view of what public relations is? I know in a previous episode you kind of situated us with communications more broadly and then PR falling within that. Does my statement accurately capture what PR is?
It accurately captures a piece of what PR is, for sure. To give a broad definition to it, public relations is all about building those mutually beneficial relationships that help your organization reach its goals. So when we think about in a public health context, it's not just about the reputation of your organization. It's also about literally getting people to change their behavior, do something different, learn something different, start a new preventative method, that type of stuff. So it's not just about your organization, but it's actually about building that trust so that they will listen to you when you, explain what might need to be done to improve their health.
So is that why, I guess now I just thought about it, I had a bit of a bozo moment. Relationships is part of the word. So it makes sense how you describe it.
Yeah, it's all about
one of the end
relationship with the public in a positive way. You're not just manipulating them. I feel like PR gets a really bad rap sometimes for that, but it's about making sure that both parties benefit.
And now just to get the technical stuff out of the way. So we talked about communications, we talked about PR. I know you also have expertise in marketing. Is marketing more of a vehicle to do that work, or where do we situate marketing in this intertwinedness of PR communications?
Yeah. So marketing and PR are best friends, and there is a lot of area of overlap, but kind of the main difference is that PR is warming the room and marketing is more focused on sales or signups, or you know what I mean? That
some
action.
kind of conversion.
Yeah. So it's more focused than public relations, which is we are focused and we always have a goal. There's always a call to action, but we also want you to feel really good when you're done interacting with the organization. Okay. So yeah, it's a little bit more of a two-way
street. In the context
street.
of a PR, maybe the work that you do, I'm thinking maybe something like fundraising campaigns where the goal is to get someone to invest in the cause. And you use marketing to do that, but you also embed PR so people can feel good about
so that they understand the why behind their giving. Yeah, absolutely.
Okay. So now I have an abstract question for you. So how does public health make room for PR? Or maybe you feel that it's the reverse. How does PR make room for public health? I know we talked about the chicken or the egg earlier.
Yeah.
How do we situate public health and PR together?
Yeah. I mean, you can't have public health without relating to the public, right? Without public relations. So I think it's really important that there's, you know, whether it's formally named public relations or not, right? Like
Mm-hmm.
it's happening because we can't just do the science in a silo and expect it to go into the communities. So driving that and driving people to understand why they need to change certain behaviors or see a doctor at a certain time. One of the best ways to do that is through a way that builds trust. So traditionally, that's been a lot of like media relations. These days, it can look more like working with social media influencers and things, getting out into the community, having meetings, talking to people like face to face. Like public relations can facilitate all of that in a way that keeps your organization's goals and brand and voice intact. And I'm totally biased, and I admit it. But I fail to see a world in which public health can be successful without public relations.
And isn't that kind of an explanation of why we are where we are with some things? I know in previously we talked about vaccinations. There's some broken trust there, but also some misinformation, which makes a giant unattractive scrambled egg. And then we get the situations that we're in now with the rates going down and resurgence of vaccine preventable diseases as an example. Now, I want to talk about what does it look like when PR and public health are successful? You're the forever optimist. Vaccinations are kind of a doozy right now. But what does it look like when there's a good marriage between public health, PR, the public? Like, do you have examples that come to mind from things that you've been involved with through the various organizations that you've worked with or clients that you work with now through your business?
Yeah, absolutely. So when I was at the American Heart Association, my first couple years there was when the guidelines changed from having to do chest compressions and breath with CPR to just like hands only CPR. So you only had to do compressions. And that was huge. I was at the local office at the time. So obviously, like, you know, cog in the machine for sure here. But sharing that information, like when we were so well resourced, I think that there was an agency involved. Like we had all, oh yeah, there definitely was an agency involved because we had an awesome PSA that had Ken Jong in it, and it was funny and it was timely. It was
Wow.
2010, so it was a good time. But we were a well-resourced team. We had a huge footprint because everybody who worked for the American Heart Association was ready to go out, and we had messaging, we had PSAs, we had community education, we had all sorts of like just simple training, we had a little video. And because we were well-resourced, I mean, people know that there is a simpler way to do CPR now. And the stories that we heard after that of like kids who learned it in school doing saves and like, people not being as afraid because you don't have to be that,
Okay.
close to somebody necessarily was really impactful. So I think the more resources that organizations can give to PR, it can be so big in terms of like creating that impact. I love to see people trust the process of PR and just see how it can really kind of change the conversation.
So, what would you say then what are some key elements that make campaigns successful? And then on the inverse, when things go wrong, what typically is the issue in those PR campaigns?
Yeah. Whether we're talking public health or really anything else, the biggest thing is to be really clear on what the organizational goals are. And when we're working with public health, those goals are almost always around some kind of behavior change or some kind of change that individuals or healthcare providers can make. So when you're clear on that goal and you're really clear on knowing the audience, like who are the people that are most in need of getting this information and what do we know about them? How can we speak to them in a way that's going to resonate and be relevant? Because when you lose that, it's a lot of wasted resources. How you talk to folks who are living with heart failure is going to be very different than how you're talking to moms who just learned that, they're pregnant with a child who will be born with a congenital heart defect. So being mindful of those differences in your audience and just kind of thinking through how can you putting yourself in in their shoes really and thinking how you can move them and support them and build a system around them that can help them get to that end result that's it going right for sure.
One of the things I've seen you talk about in your work and the blog posts that you write is the idea around the importance of connecting emotionally to different audiences that you're trying to build that relationship. I'm going to use that word because it's not a manipulative, it's a mutually beneficial relationship.
Yes.
So for organizations or initiatives that have what is a important public health issue to tackle but aren't getting the traction they need to make that impact, who are struggling to connect emotionally to the audiences, what advice do you give them based on your expertise? What are some of the best places to start?
So I think it's always nice to start. It's going to sound real cold and real clinical, but we start with the goal, right? Like, what is the public health goal you're trying to move? And then again, kind of breaking that down
Can you
into
have bad goals? I guess
yeah.
I guess what I'm trying to say is a goal can be, the idea can be there, but it can be poorly written or
Mhm.
conceived in such a way that the execution then falls flat. Do you know what I mean?
Yeah, totally.
Yeah.
Yeah. So if you're not clear, if you are out there and you're like, we want to increase flu shots. Okay, cool. We're going to need to, how are we measuring this? Like,
Okay, that's what I'm getting at.
what are we really talking about here?
Gotcha. So what would be a better example of, instead of
Yeah.
saying
So
that?
I heard this from a friend, and it's not just the SMART goal, but it's the smarter goal. So your
Smart.
specific, measurable, actionable. Oh, did I already do the R
Re-
S N A R?
result.
Yep. Yep. Result. Well, I don't remember the R.
R T time bound.
Time bound, yeah.
Yeah.
But then the ER at the end is ethical and responsible. And I really love that. So it's thinking about, are you setting a goal that's reasonable, that's doable for people? So again, going back to flu shots, you would want to have like that end date, like by the end of this year, we're wanting to increase flu shots by 5% among this specific population, just being more clear. And that also really helps when you're formulating that PR plan because you know where the guardrails are. You know how you can say, was this successful, yes or no? So you can definitely have
Okay.
a bad goal.
So you'd say, like, go back to basics, start with a great goal, and see where it takes you from there.
Yeah, I mean, and then really getting to know that audience. Like, where are they? Where are they getting their information? Where are they currently getting their health information? What are their most trusted sources? And then
Mm.
going straight to those sources, whether it's, it might be on TikTok, and that's fine. Like, go there, talk to who they're listening to, and build a relationship. It's not just like, about saying, hey, what you're saying is wrong. We need you to say
Mm-hmm.
this instead. That's not going to do anything.
Mm-hmm.
But building those relationships and giving people relevant information in a way that works for them. And, the question was about emotional storytelling. So I'm
No,
going to go
we're
back.
getting there.
We forget there. It's so important that it's not just a cold fact. You can't just say like 1 in 3 people experience this disease. You need to really draw it out. Like, don't you want to be one of the people who is like living 7 years longer because you're not impacted by this chronic condition? Or here's the story of somebody who's very similar to you, who's experienced this and how they're getting through it. And I think, especially when it comes to speaking to an audience who is experiencing chronic illness and chronic disease, it's really important to not paint those other patient stories as like, heroes and perfect and clean and everything turned out fine, but more to be real and to tell people how it can be tough. And there will be moments when it's okay. And there are moments when, it's, it's very hard.
So is that the science of it then? I have to then connect with a message to listen to it first? Is that kind of how it works?
Yeah, if a message isn't relevant to us logically or emotionally, we're definitely not paying attention to it. So, yeah, that's a huge piece of it.
Okay, sidebar again. How do people know where to find their target audience? Is that something that you'd have to consult with someone who's an expert in that? Or is there like a commonsensical way to go about that exercise?
It can be done on a shoestring I believe you can do everything with what you have, but obviously market research is its own wild beast and like really, really helpful. The more you know, the better. But at a minimum, you look at that goal, like who are you trying to move things with, and just dig in. Who in that group is your organization already connected with? And like, can you, ask them some questions, get to know them, like look at the data your organization has and just learn from all what you have in front of you. I think that's the best way to do it if you're not looking to employ a market research firm, for sure.
I want to move on to, we talked a little bit about patient stories, but something just popped in my head too. We're in the rise of AI and generative AI and ChatGPT. Is that good for PR overall, or is it bad for PR? What's your hot take on that?
My hot take on AI is that it's like, oh, it's very misleading. Like it makes bad writers think that they're good writers because all of a sudden they have a lot of words in front of them.
Okay.
Uh,
Okay.
Folks
Okay.
in PR, we love writing. We pride ourselves on our ability to string together coherent thoughts that are
Mm,
beautiful and memorable and actionable. But
okay.
ChatGPT doesn't do that. You see the
Mm,
patterns and also like just all the idiosyncrasies that it has. It's a tool like anything else.
mm,
I use AI for certain things, but I'm never asking it to write pitches or write stories or anything. That's not its use.
mm. So in a way, I think what you're saying there is it lowers the barrier of entry, which in that sense it can be harmful because you're getting people who don't have the right expertise maybe living in that space. But if you are an expert in the field, there are different use cases that it can be used for to enhance your work. But by itself wouldn't be a substitute for writing
No,
to
absolutely
connect with
not. It
people.
would give you false
At
confidence.
least
And
not
like,
yet.
yeah, I mean, yeah, not yet. Feel free to write a pitch with ChatGPT and send it out and see how far that gets you. Yeah.
That's a takeaway.
Yep.
All right, so moving on to the critical piece of what we're talking about too. So I think I like living in the high level space of PR, bigger messaging, like mass messaging, connecting with an audience, building relationships. But there's something to be said about, and you've mentioned it several times, about patient stories being very, very, very important. And I think right now there's consensus in across sectors and disciplines that is the case. Whether it's a patient or a client, whatever business that you're in, those stories are important. Now, what about patient stories in public health in particular makes it so impactful? So you gave some examples about like diseases not kind of glamorizing and making people
Mhm.
seem like they're heroes. What's the secret sauce that makes stories, patients, messaging the right fit together?
It's so important because what I write for when I'm doing anything in the public health realm, like, whether it's writing a news release or writing a story and I'm including disease information and patient information, I always imagine that person who's newly diagnosed and their doctor says, you have this, don't Google it, you'll get scared. And of
Mm,
course, you Google it right away,
mm-hmm,
right? So,
mm-hmm.
like, having a story be that soft place to land, not that list of statistics, not that list of
Okay.
symptoms, but to be, I am a real person who experienced this. There were ups and downs.
Uh-huh.
And like, I'm a friendly shoulder, right? Like the first friendly
Mm,
shoulder that somebody might encounter, because as we know, chronic disease can be really isolating. So like having this virtual, very distant, like network, I think is really important and a super beautiful thing about intentionally telling patient stories about public health.
and so now what this means is whether it's nonprofits, public health, all have a responsibility to include patients in the telling and the crafting of their stories because it has such a big impact. But it's probably harder or easier said than done, rather,
Mhm.
because I remember you even sharing about when you were living in that space, one of your positions, it was particularly difficult around the COVID piece and learning about the difficult stories about patients who didn't call emergency services because of what was going on with COVID when there was like a heart attack or probable heart attack. So that's like one piece, the emotional toll it might take on the person who's helping to tell those stories. But there's also the mechanics of it, the logistics of it, the ethics around it that people have to contend with. Can you talk about what a proper collaboration looks like in working with patients or a patient to tell the story and making sure that we don't cross over any boundaries? Like, what's a 1, 2, 3 step about collaborating with patients?
Yeah, absolutely. So I think it's really important to always start with a patient who is raising their hand and saying they're ready.
Okay.
It's not about like asking somebody at your organization, hey, we need somebody who fits this profile, and then kind of like convincing them to tell their story. No, they should like, because it's vulnerable, it's personal, like it's theirs. We shouldn't take it from them.
Mm.
So always working with patients who are raising their hand saying, I want to do this, I want to tell my story. And just having thoughtful interview techniques, I think, is really important. Letting the person know that, you're recording it because you want to be able to get everything right and not be taking notes constantly. Letting them know that if they're more comfortable, they can invite somebody else to join the interview. They can stop the interview at any time. They don't have to answer every question. And just building some rapport with them, like getting to know them as a human, not just an example of a disease state. That's really important. So I always go off the rails when I'm on these interviews, like just asking random questions. It's not like just a cut and dry
Mm-hmm.
necessarily. And then when it comes to the actual sharing of their story, obviously giving them the chance to review it and to correct any, not just even facts, but like if there's just any wording that they don't like, anything that doesn't feel like them, that's fine. I always make those changes. And I think it's also really important to make sure that they know that they also have the opportunity to ask that the story stop being used at any time, you know?
Oh, that.
Yeah. Yeah. Cause like a lot of,
So the
like,
ownership piece is they
yeah.
have.
Yeah. You don't want to feel like you gave your story away and then 20 years later things change, but there's still this video out there from when you were a kid talking about whatever it was. So giving that ownership, making sure that they're aware that it's a true collaboration and that
Mhm.
as an organization you appreciate their generosity and their gift of time and their gift of vulnerability because it's helping you again be that soft place to land, also convey something that hopefully will impact other people. That's what every patient says when I do an interview is like, if my story helps one person, they all say
Mm.
that. So
Mhm. Now, how does that work in practice though? So to be able to have control to say you to stop using my story at any time when you might have multi-million-dollar campaigns based on a story, is there a contract that's signed? Like how does that work in practice? How does that work?
So I have actually never been asked to take a story down. So I don't fully know that, but typically, yeah, anytime that if you're a smaller organization, you should definitely have a media release that kind of lays out what the story is, how it will be used. Have a lawyer help you with that. I'm not the one.
Mm-hmm.
But, and to have it clearly spelled out in there, I think is really helpful.
Is there best practices around compensation for the patient telling the story or not? Like, how does that piece work too?
I think it's always nice to pay people for their time. Working with a lot of nonprofits, that's not something that I have a ton of experience in, but I know that it's always good to show appreciation for folks. So if it can be done, it should be.
Now, the other part that I think is important, which you also alluded to in your flexibility around the interview itself, about how you don't necessarily stick to the script, is around making sure the stories still have the voice of the patient, that they're personal to them, that they're culturally sensitive, and it's not an oversimplification, and it's not tokenizing in a way that doesn't feel right. Can you speak to like the actual techniques of doing that? I know you mentioned too, as part of your process, you'll come back to them and say, this is what we're going to run with. What are you comfortable with? What are you not? That's kind of a safety point there to prevent things from going out that don't feel right. But
Mhm.
anything else that you could speak to in terms of making that become a reality?
Yeah, I mean, it's really all in those interview questions. If somebody, like, I've got my standards. When were you diagnosed? What was it like? What was your course of treatment on this? But in those answers, there's always more. They'll say something like, and I ended up getting divorced because the treatment was so rough on my body and I was so grumpy and okay, let's
Oh,
dig into this. Or they'll
okay.
say that throughout the course of my treatment, my community rallied around me and I had friends I didn't even know I had coming out of the woodwork. So you just kind
Okay.
of
That's a story right
follow.
there.
Yeah, you just follow where they're going and you kind of get a sense of what's important to them in their story.
Mm.
Um, and you just tease it out.
So what I'm hearing from you is it's not always about the thing that you think it's about.
Yes. Yeah, there's a surprise in every interview for sure. You probably know
Mm.
that.
Okay, okay. So now bringing this all full circle. So you've shared a lot of tidbits that I hope that will help me as I incorporate some of them in my practice and many others, I'm sure. But for people who are still stuck and maybe want to make transformational changes in their organization that requires more than just listening to this podcast, can you talk a little bit more about specifically how small adventures communication comes into this? So tell me about, like, I reach out to you and I say, I need help. I need to do this. Walk me through how you get me to that place where we're really pleased with how we're telling patient stories and the resulting outcomes. Can you fill in the blanks there for me?
Yeah, yeah, absolutely. So, I think it's really important that if you sense that you need help telling stories in an organization, that you're not alone in that. So making sure that like your organizational leadership is bought in and sees the value in this is really, really important. And if that's not something you have, that stinks. And I would love to help help you get that buy-in from up there, show the importance and the value of this. But then, my first step in working with clients is always to understand their goals and the resources first. So, like, what are the things that they're trying to move the needle on, and what have they been working with in the past? I come in, with a certain set of skills, and the more we can make what they already have in place, as far as a communications plan, kind of work together with what I can add. That's really, really going to be much more impactful because public relations on its own, it falls under, again, that
Mm.
communication umbrella. So the more that we can line up what we're putting out in media with other stuff, that's it's always going to have a bigger impact. So working together on a plan to use PR to really reach those goals, working cross departmentally
Mm.
with marketing folks, with paid advertising folks, with social media folks to make sure that we're telling the same story and on the same page and getting those patient stories, like, not just posting it on the website, but also putting it in all the other
Mm.
places so we can really leverage it is really important too.
To bring this home, as part of that PR plan or broader communications plan, it's starting to click for me now that you have to be intentional about how you engage with the media too, in a way that aligns with the goals too. So whether it's visibility to get to this goal, or you wanted to expand reach of a certain story, or something of that lines. So part of that PR plan also includes like when and how to pitch media and with what to pitch media with. Is that, like, I'm trying to like visualize a PR plan. Is that somewhere in there?
Yeah, yeah. So typically in a PR plan, you'll have a media relations section, which will include maybe just loose ideas to start. Like in Women's Health Months during May, we want to make sure that we're talking about this or some. And then once you're in it, you're kind of digging deeper to find those stories, find those talking
Mm.
points, find those subject matter experts and things like that. Yeah. And then the other piece of that is really also making sure you've got your plan of what you proactively want to do. You also need to be prepared for whatever's going on in the big wide world. And so having at least a rudimentary crisis plan for if things go sideways or if funding slips, making sure that you know exactly how to approach that in terms of PR and making sure that you're still building those good relationships with folks.
The crisis piece. Let's live
Yeah.
there for a second, because people tend to think of crisis, especially with the chaos the distracting chaos. Crisis could look like, yeah, loss of funding, damage to reputation, for example. But a crisis could also be, you know, one of the implications of losing funding is perhaps having very upset patients that you work with and who are part of driving that mission forward and reconciling about how they feel about things. Is that kind of part of what would be included in a crisis plan too? It's not just about like hey, media, everything's good. Don't look under the hood. Like there's
Yeah.
other elements to it as well.
Absolutely. Yeah. I mean, when we're thinking about responding to a crisis, obviously you want to make like the number one priority is to obviously keep everybody safe if that's the type of crisis that it is, but also to protect the reputation and the credibility of the organization. So you want to make sure that you're telling the media, what's going on and that you're being transparent and factual, but at the core, you want to make sure your internal stakeholders are feeling good. And that would include patients that your organization serves. That would include volunteers, staff members, like that internal piece. Nobody, unless you're really in a fast moving, wild crisis, nobody should be learning anything from the media. They should be hearing it from you. And that is definitely part of your crisis communications.
I see. We're at the end. Any final glaring messages that you want to leave our audience with? Takeaways from our conversation?
No, I mean, I would like to thank your audience for all that they do. Public health is not easy work. And I just really appreciate every person who dedicates their career to this. So hats off to you, people.
This show was edited by me, Gordon Thane, with additional editing from LaShawn Benedict. Sound design and mixing by myself and LaShawn Benedict. The original music from The Music Room, composed by Tom Fox, licensed from Johnny Harris. The cover art designed for our show by LaShawn Benedict. The Public Health Insight Podcast is produced by PHI Media. Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.